This lecture is going to be on causes of hypercalcemia. There are 8 main causes of hypercalcemia, and they are listed here along with a mnemonic to remember those causes. The percentage following each cause of hypercalcemia is the proportion of cases of hypercalcemia that occurs in dogs. So, neoplasia, renal failure, and hyperparathyroidism are the most common causes of hypercalcemia in dogs. Hypercalcemia due to granulomatous inflammation most commonly occurs in dogs. Most cases of granulomatous inflammation do not cause hypercalcemia, but when hypercalcemia does occur, it's due to excessive production of vitamin D by macrophages. The inflammation is typically due to a severe infection, such as seen with blastomycosis or pitheosis. Cytologic abnormalities are indicative of inflammation. Osteolytic disease most commonly occurs in dogs and less frequently in cats. The most common causes of severe osteolytic disease are malignant neoplasms, including multiple myeloma and osteosarcoma. Multiple myeloma is a neoplastic proliferation of plasma cells at multiple locations within the bone, and osteosarcoma is a malignant proliferation of osteoblasts, and the osteoblasts are the cells that produce bone. Supporting evidence for multiple myeloma is a monoclonal gammopathy, or hyperglobulinemia, and both multiple myeloma and osteosarcoma can cause increases in the bone isoenzyme of ALP. Primary hyperparathyroidism most commonly occurs in dogs due to a neoplastic proliferation of the parathyroid chief cells. Phosphorus may be normal or increased, but it is not decreased. ALP may be increased due to increased bone activity. An appropriate response to hypercalcemia would be for the PTH to be decreased. So, an inappropriate response to hypercalcemia would be a normal or increased concentration of PTH. About 75% of hyperparathyroid dogs have normal concentrations of PTH, and 25% have increased concentrations. Hypercalcemia can cause nephrogenic diabetes insipidus, so the urine-specific gravity may be less than 1030 in dogs. Urinary tract infections may occur secondary to unconcentrated urine and calcium-containing uroliths. Vitamin D toxicity may occur in any species. Toxicity due to cholecalciferol-containing rodenticides tends to occur in small animals, whereas large animals may ingest a large quantity of ergocalciferol-containing plants. Vitamin D toxicity typically results in marked hypercalcemia and marked hyperphosphatemia due to increased intestinal absorption, increased resorption from bone, and decreased renal excretion. When the calcium and phosphorus product exceeds 70, then the animal is at risk for metastatic mineralization, meaning that calcium and phosphorus bind to each other and they precipitate out of solution and deposit in the tissues. This picture shows white foci mineralization on the serosa of this intestine, and those are areas of metastatic mineralization. Metastatic mineralization can occur throughout the body, and this leads to organ injury, insufficiency, and failure. Addison's disease, or hypoadrenocorticism, occurs in dogs most commonly due to immune-mediated destruction of the adrenal cortex. With this destruction, there is decreased production of cortisol and aldosterone. The cortisol deficiency causes a lack of a stress leukogram, or it could cause a lymphocytosis or eosinophilia. Hypoglycemia and hypocholesterolemia may also be present. And 30% of dogs, Addisonian dogs, have hypercalcemia due to increased resorption of calcium from the ultrafiltrate. Low aldosterone concentrations causes hyponatremia and hypochloridemia, hyperkalemia, and inadequately concentrated urine. Hypercalcemia may occur in any species with acute or chronic renal failure. However, the pathogenesis is different. Horses absorb abundant calcium in the diet. Therefore, large amounts of calcium are excreted in the urine so that hypercalcemia does not develop. This is why horses normally have many calcium carbonate crystals in their urine normally. If renal failure causes a decreased GFR, then not enough calcium is excreted and hypercalcemia develops. In non-horse species, excessive calcium absorption from the diet typically does not occur. Therefore, the kidneys tend to retain calcium during times of homeostasis, and decreased GFR does not cause hypercalcemia. However, calcium can bind to negatively charged uremic anions that are retained in the blood during times of renal failure. Horses with renal failure tend to have hypophosphatemia due to urinary loss of phosphorus, but some may have hyperphosphatemia due to a decreased GFR. Dogs and cats tend to have hyperphosphatemia due to decreased GFR, but they could have hypophosphatemia due to decreased tubular resorption of phosphorus. Hypercalcemia due to neoplasms is termed hypercalcemia of malignancy. The hypercalcemia may occur by 3 different mechanisms. Malignant cells may produce a PTH-like hormone called parathyroid hormone-related peptide, or PTHrP. The net effect of this hormone is similar to PTH in that it increases calcium concentrations and decreases phosphorus concentrations. PTHrP production is most commonly seen with lymphomas and apocrine gland adenocarcinomas of the anal sac. Monoclonal gammopathies may rarely cause hypercalcemia, and they do this by increasing the protein-bound fraction of calcium. This can occur with multiple myelomas or B-cell lymphomas and leukemias.